Like the White House guidelines, Oklahoma's plan to open up and recover safely has 3 phases. We will not move to the next phase until the data tells us that it's safe to do so. I want Oklahomans to know that even as things begin to open, it is so important that we continue to practice social distancing. Keep washing your hands, stay at home if you're feeling sick. This is a careful and measured approach designed to protect our most vulnerable while safely easing Oklahomans back to work. With that being said, let's talk about phase 1. Based on the data, Oklahoma should continue to follow safer at home guidelines if they are 65 or part of a vulnerable population. Continue to maximize our physical distance from others while in public. Avoid social gatherings in groups or facilities that do not readily allow for appropriate physical distancing, and minimize non-essential travel. Based on the data, employers should create plans to allow employees to return to work in phases. Common areas like break rooms should remain closed when possible. It's also important businesses honor requests of employees who are part of that vulnerable population for special accommodations. Starting on Friday, personal care businesses can reopen for appointments only if they adhere to strict sanitation protocols and are in communities that do not have more restrictions in place. This includes hair salons, barber shops, spas, nail salons, and pet groomers. These businesses must maintain distance between customers and encourage customers to wait in their car until it's time for their appointment to avoid congestion in the lobbies or their entrances. Grocery stores should continue to maintain special hours to our most vulnerable populations. They have done a great job, and it's so important that they keep those special hours for our most vulnerable, our elderly populations. Starting on May 1st, the following businesses can open statewide if they adhere to strict social distancing and sanitation protocols. Restaurants, dining rooms, movie theaters, and sporting venues and gyms. Places of worship can reopen for in-person meetings or worship, provided that staff and volunteers wear masks when interacting with the public. They abstain from serving food or coffee, sanitize between services, and keep their nursery areas closed. During phase 1, bars need to remain closed. More specific guidance will be available on the Department of Commerce website. This is important. If our hospital and our incident rates remain manageable for 14 days, we will then move to phase 2, but only if our data tells us it's time. Phase 2, elderly and vulnerable Oklahomans should still follow safer at home guidelines. Non-essential travel can start resuming. Employers should still close common areas and gathering places. Phase 2 allows for organized sports activities to reopen under social distancing and sanitation protocols. Bars can operate with diminished standing room occupancy with social distancing and sanitation. Funerals and weddings can resume with more than 10 people. Children's areas and nurseries and places of worship can reopen. And phase 3, if our hospitals and incident rates also continue to remain manageable for another 14 days, then we'll move into phase 3. We will provide more detailed guidance of phase 3 when we are into phase 2. Again, we are making decisions for Oklahomans that are based on the data in our state and to protect the health of Oklahomans. I've been on the calls with Dr. Fauci from the White House Task Force, and he has talked about how reopening will not be like flipping a light switch on and going back to normal, Our plan is a measured approach, and we will continue to watch the data each day, and we'll pull back if we need to. Let me be clear. We need to continue to practice social distancing and keep doing our part. Wear a mask if you're in public. We will continue to watch the data every day, and we will pull back if we see our cases spike or our hospitalizations increase. There is light at the end of the tunnel, and it's starting to get brighter every single day as we do more testing and we continue to watch those curves flatten. So thank you, Oklahoma, for taking this seriously and doing your part to get it to this point. God bless you, and God bless the great state of Oklahoma.